Hello, my name is Dan McKee. I'm the President and CEO of Grace-Inspired Ministries. Today is Friday, June 5th, and I wanted to provide some updates on some changes we have on our campuses. First, I'll update you on the cases on campus and testing. So you can find out the active cases, and currently we don't have any active cases for residents on either campus, but you can get our cases and test results on our website under the testing tab. We also have our 800 numbers posted there where you will be able to get recorded information, and we are also posting our memos and letters to residents on the website. As far as testing goes, there's been some change in guidance on testing recently from the Pennsylvania Department of Health. So you've probably heard some things about baseline testing and weekly testing of residents and staff. And what we've kind of concluded is testing alone is not the answer. For a number of reasons. One, there's limited testing materials available, and what we've seen as the more facilities are testing at this point, the test results are slowing down, getting those results. So we were at 24 to 48 hours to get results a couple of weeks ago. That's now at 3 days plus to get test results. A second issue with testing is reliability. So first and foremost, was the test administered properly? Did we get a good sample? We've also seen that new studies suggest that tests may not reliably return positive results in the first 3 to 5 days following the infection. So that's a cause for concern as well. There's potentially some safety issues with testing weekly, in particular testing our residents weekly. So if we were doing it that often, could we potentially be injuring a resident or the nasal passage of a resident in doing this repeatedly and often? That's a question for us. And finally, cost is a concern for us. So I don't say that judging, what's the benefit of the cost for the benefit of testing versus the cost of testing. It's not a simple cost-benefit analysis, but for Grace-Inspired Ministries, to test all of our employees weekly would cost about $300,000 a month. And I'm not sure there's any community in the area, retirement community, that could afford to do $2 million plus in testing for employees at each campus. So with that, we will continue to have a low threshold for testing as far as symptoms go, and we will include some type of regular testing as part of our overall infection control plan. Next, I'd like to speak directly to our employees. First issue I'd like to cover is vacation. So we're in vacation season. We want you to be able to take your vacation, do that safely, to keep yourself and your family safe, and also to keep our residents safe upon your return. So we have updated a vacation policy that we want to follow during this pandemic. Tracy issued that earlier this week, and it has a lot of detail regarding whether you're traveling by plane, traveling internationally, traveling by car, maybe being gone for a long period of time, and has specific things that you'll have to do when you return, whether that's wear PPE in some cases, and in some cases we may require you to quarantine for 14 days upon your return. By and large, you should be able to take your vacation and return and not have too much restriction-wise, but please review that policy. If you have questions, talk to your supervisor or reach out to Tracy and HR to discuss that. Next, I want to thank you again for all you've done to be safe, to keep your family safe, and to keep our residents safe. We appreciate what you do, in particular when you leave the campus and following CDC guidance on staying safe and really making an effort not to bring the virus on campus. We'll ask you to continue to monitor for symptoms, and please call out if you're not feeling well. Let us know. And we promise to continue to keep you updated with communication, whether it's things we post at the time clock, memos we issue, things we post on our website as well. So we will keep you informed. Next, I'd like to talk about the yellow phase that we're entering and the easing of some restrictions. So please know that Governor Wolf has exempted nursing homes and some senior living congregate settings from the easing of restrictions. So we are very cautious in easing some of these restrictions, and we should be cautious. We're still saying no visitors within our buildings, no matter the level of care, whether it's skilled nursing, personal care, or independent living. And the reason is pretty simple. Less people in the buildings means less exposure for our residents. So we will continue to ask for no visitors in the buildings. We do have an eye towards a second wave of infection, and we want to make sure we're planning and we're better prepared when that does happen. So the second wave could happen in the fall. You've probably heard talk of that. We think it may happen as early as late July or August. And what we know is new cases will continue to happen on campus, and there is a correlation between the level of restrictions we do and the number of cases. So please know that the campus restrictions could change at any time. We're continuing to monitor the spread of the infection within our community. Bucks County has a great website for that, where they show the number of daily reported cases, and it's a good indication of what's happening with community spread. And we will continue to follow that and adjust the restrictions accordingly. We know there's no right or wrong answer on the level of restrictions, but we will continue to do our best to avoid the negative impact of restrictions, including isolation and lack of socialization. So we're working at this point at also restoring some additional services in the weeks to come. In particular, dining service in our dining rooms. How can we do this? What type of safety precautions do we need, and how do we socially distance while doing that? We'd like to, in the weeks to come, open the fitness centers and pools, start small group activities, and open the hair salons as well. So these services will be different than how they've been done in the past. Some of them may be by appointment only. And we will continue, and we'll only do those when we know we can do those safely. So we'll continue to work on the policies and procedures for those activities. Finally, I have a few reminders. One is please continue to follow the CDC guidance on hand hygiene, social distancing, mask wearing, and avoiding group settings. For our family members, if you are dropping off packages or supplies for residents, please come to the main entrance with those. It's best to do that between the hours of 9 a.m. and 4 p.m. You should label those packages with the resident's name, apartment number, and building number. It's important to include the building name on that. And then if you have perishables with those deliveries, please let the receptionist know so we can get those out to the resident as quickly as possible. Please call Robin Bickle in Resident Services if you have any special requests. And I would like to close by expressing my gratitude to all of our residents and family members for your patience and understanding during this time. I'd also like to extend my thanks to our employees who continue to do a great job and provide great services to our residents under difficult situations. So thanks to all of you.